Can you start the slides from the beginning? Wonderful. Okay. Are you there?
Yeah, yeah.
I'm so sorry. We've had a little bit of a mix-up.
Okay.
Dr. Berks, I know this is a big question, but do you mind starting from the beginning?
No problem.
Thank you. So thank you everyone for joining. I'm just going to put my camera on. There we go. Technology, I tell you, but thank you very much for bearing with us. My name's Laura. I work with the 7 Insurance Broker team as the Wellness Manager. So thank you very much for everybody who's joined us. Well, the topic that we're covering today is men's health, and I am not an expert in that field. So on the basis of that, I have brought in the wonderful Dr. Robert Berks from Mediclinic, who will be sharing all his knowledge with you today. So yes, thank you very much for everyone for bearing with us. I promise it'll be well worth it. So I'm going to hand you over to Dr. Robert, who is going to impart all his knowledge into you today. So thank you.
Good afternoon, everyone. My name's Dr. Rob Berks. I'm a family medicine consultant at Mediclinic Dubai Hills, located in the lovely Dubai Hills Mall. The clinic's been open about 2 years just now. If you've not been, please do pop your head in, have a look round. Beautiful, light, airy, full of lovely doctors. Anyway, the topic for today's presentation is men's health. Topic very close to my heart. Laura, next slide, please. Thank you. So why is a focus on men's health important? Well, men don't live as long as women for various reasons, medical ones, cultural ones, and some behavioral ones. And so the point of the talk today is to help men in the audience to live healthier and longer lives. There's going to be a strong mental health focus in this talk, and I want to highlight early, unfortunately, men account for 75 to 8% of all suicides. So we highlight male depression as a major health crisis. One of the big reasons why men seem to struggle when it comes to their health is so-called maladaptive masculinity. This is behaviors that can be harmful to men themselves as well as those around them, and we'll cover that in a lot more detail shortly. There are, of course, cancers that affect men specifically, and there are cancers which are common in men. So next slide, please, Laura. So what are the main health issues that we're going to address? Heart disease, and there's important lifestyle choice that can increase or decrease risk. Mental health, depression, anxiety, and suicide, and we'll touch on alcohol as well. Cancer, prostate cancer, testicular cancer, and then we've got lung and bowel cancers, and then finally we'll round things out with a look at testosterone. Next slide, please. So heart disease, this is the leading cause of death amongst men and women globally. So we need to think about what causes it to reduce the risk. Just a little note before I dive into it. When we think about heart disease risk, we think about stroke risk because to a doctor, they're one and the same. And we think about cardiovascular disease, CVD, we think about coronary heart disease, CHD. To a doctor, that's one and the same. So what causes heart disease? How can we manage our risk? We're going to kick off with a big one, that's smoking. So death from coronary heart disease is much higher in smokers. Even those that are exposed to passive smoking, unfortunately, they too also have an increased risk. So even if you don't smoke and someone around you does smoke and you're regularly exposed to them, unfortunately, you've got an increased risk of heart disease too, be it at home or in the workplace. WHO, I've done a lot of work on this, and they think that 20% of cardiovascular disease is due to smoking directly, which is quite a concerning statistic. It's 1 in 5. So that's smoking looked at. Poor nutrition. So increased risk of cardiovascular disease in patients with essentially poor diets. Diets that are high in fat, not the good kind, which we'll come to shortly. High in sodium and sugar, and low in complex carbohydrates, fruit and vegetables, according to a World Health Organization report in the early 2000s. So when we think about hyper-processed foods, fast foods, ready meals, things that are always around us in first world societies, we think about trans fats. These are when liquid oils get made into solid fats. e.g. margarine. Unfortunately, trans fats have appeared in fast food, processed food for a very long time. Many world governments are getting rid of trans fats from their nation's diet for good reason, because it's been shown to be disastrous for cardiovascular disease risk. Now, how do we reduce the risk with our diet? Well, having a diet that's rich in oily fish, which has omega-3 fatty acids, as well as having a high fiber diet, both reduce cardiovascular disease risk. So fast food, processed food, not good for our chances. Healthier foods like oily fish, fiber in a diet, much, much better. Obviously, fruit and vegetables also contain fiber, amongst other things, of course, and they're also beneficial for our risk profile overall when it comes to cardiovascular disease. Next slide, please, Laura. So, heart disease continued, psychological well-being, stress increases the risk. We've all heard stories about executives in executive suites dropping dead one day due to stress, and this is how it happens, unfortunately. It's a real phenomenon. It's the kind of thing which we're trying to get more of a handle on, identifying these people early, trying to meet with them, trying to get them changing behaviors so they spend less time stressed and more time in a calm state. Obviously, with stress comes blood pressure, or it certainly can come with blood pressure issues. Blood pressure, we know from a very large study done in Western Europe in the early 2000s, the InterHeart study, that it's got a direct connection with the risk of heart disease. And they actually discovered that 22% of heart attacks in Western Europe were due to a history of high blood pressure. We know that the risk of cardiovascular disease goes up significantly with untreated high blood pressure. Cholesterol, which we kind of touched on a second ago when it came to diets, but we know that, again, from this massive study that's done in Western Europe in the early 2000s, almost half of heart attacks are due to a high cholesterol reading. That means that cardiovascular disease risk is related to cholesterol levels. Now, there are genetic factors with blood pressure, with cholesterol. Obviously, I'll touch on diabetes shortly, which, yeah, they're present, and these individuals with a high risk from a present family history of blood pressure or cholesterol or diabetes need to be managed in a certain way. And I urge you, if you are in that group, to go and see your doctor if you've not already done so. Moving on to things that we can control more. So being overweight, being obese, that's a risk factor for heart disease, as well as things that can lead to the risk of heart disease, like high blood pressure and diabetes. I'm adding in here pre-diabetes, which is kind of like a precursor state to diabetes. Depending on where in the world you are, this may be called insulin resistance, insulin sensitivity. I like to call it pre-diabetes because it tells us all where we're going unless we do something about it. We know that those with central obesity have twice the risk of developing heart disease. So what is central obesity? It's essentially weight around the middle, excess fat around our middles. A very good rule of thumb when it comes to deciding, if you are centrally obese or at higher risk due to this, if you divide your weight by 2, so say your weight by 2, that should be your waist circumference. So, for example, if you're 80 inches tall, then your waist should be below 40 inches, ideally less than that. So that's a good rule of thumb when we're thinking about risk associated with central obesity. Divide your height by 2, and that's what your waist circumference should be, or that should be the maximum for it, I should be saying. Laura, next slide, please. Great, diabetes. We just touched on this. So unfortunately, in people with type 2 diabetes, that's the diabetes that we go on to develop later in life. The risk of cardiovascular disease is 2 to 4 times higher. And unfortunately, local statistics show that in the UAE, the prevalence is almost twice as what it is in the world worldwide, according to the International Diabetes Federation. So we need to work on that collectively as doctors and healthcare professionals, do what we can to reduce that number, because we're putting a lot of people at risk of developing not just diabetic complications, but specifically cardiovascular complications. Right, and then family history. So unfortunately, there are genetic factors that we can't do that much about directly. As I said before, with family histories, there's clear evidence that those who have what's called premature heart disease, where under the age of 60, unfortunately, it would seem that heart disease in that family would kind of run on to the next generation. Nowadays, I would probably be even more cautious and say premature heart disease probably begins kind of under 55, just because we're seeing a lot more cases of it. Why does this happen? Well, there are direct genetic factors which can lead to this. And there's also a shared lifestyle, so diet, exercise, stress, things of that nature, which kind of seem to run and be grouped together in family groups. Next slide, please, Lauren. So what are the takeaway points here? Essentially, if you smoke, you need to stop. Don't smoke, because that will be the biggest thing you can do for your health this year. When it comes to, people often ask, how do I do it? The gums and the gels and the sprays and the patches, all well and good. They work to take the edge off. And I think we have to be realistic about how well they work. There are some medications available on the market. Again, they work quite well. They take the edge off what is quite a difficult phase in someone's life. The most important thing that I've witnessed in my own patients is people need to make an emotional commitment to stopping at a basic level where they're saying, enough's enough, this is going in the bin, and I'm not going back to this. And they recognize that there are going to be a couple of bumps in the road whilst they move through that process, but as time passes, the cravings settle and they're free of their cigarettes and all the risk that entails. Talked a lot about central obesity previously, where blood pressure, diabetes, and high cholesterol all linked in. So what does this kind of boil down to? Well, it is weight loss. How do we achieve that? Diet and exercise. Nice and straightforward. In my consultations, I talk about two numbers endlessly. Talk about 2,500 calories a day is a very useful rule of thumb for the vast majority of men that I meet. If you kind of hit that daily, it gives you a target. Counting calories, again, quite an old-fashioned idea, still works well. This, particularly in conjunction with exercise. Now, not everyone's a big gym person, not everyone's a big sport person, and that's fine. Getting our steps in, walking, 10,000 steps. Again, it's a useful rule of thumb. Is it perfect? No, but it's good enough for our purposes. And it's about sticking to this. It's about having built into our routine where we have a calorie limit and a step limit every day that we try to hit. But moving towards that, only good things are going to happen. The other thing I've mentioned here is improving the quality of our sleep. Unusual things happen around weight loss sometimes, where you can meet someone who is eating the right amounts, eating the right foods, they're getting some exercise in, they're getting the steps in, so to speak. The weight is stubborn. Obviously, we do the bit from our side as doctors, we do the blood tests, etc. Then we need to think about other things. Stress is one of them, but also sleep quality is another one. We know that overnight, a lot of restorative things happen. Cortisol levels should be going down. Cortisol is the stress hormone in the body, and essentially if people have got higher levels of cortisol, either directly or indirectly through poor sleep or stress or whatever it might be, unfortunately they can struggle to lose weight. So we know anecdotally that sleep actually helps burn fat over time with people getting good quality night's sleep. This is probably because the body's in a less stress state, and therefore it's more primed to release fat to lose the weight. Again, it sounds slightly sort of esoteric, perhaps, not very scientific. It's something that's still being worked out, but we've seen enough anecdotally for me to feel confident in saying, whenever possible, commitments notwithstanding, improve the quality of your sleep. I mentioned in here a bit of a slightly tongue-in-cheek comment. You can't outrun a donut. You need to have diet and exercise at the same time. So you need a sensible diet plan and a sensible exercise plan. One can't compensate for the other for very long. And obviously, to touch on something else about exercise, it has other benefits apart from weight loss. It clearly improves our well-being, reduces our stress, boosts our mood. So there's a lot going for it. Laura, next slide, please. Okay, right, moving on to mental health. So essentially, we've got a list of things here to look for in yourself and other people. So feelings of hopelessness, extreme fatigue, social isolation, so sort of keeping yourself away from people, low self-esteem, difficulty sleeping, alcohol excess, more of which later, anger, hiding our emotions, and the so-called maladaptive masculinity, where it is alleged that seeking help can be a sign of weakness. Essentially, these are key features to look out for yourself and in other people. Seem to be more prevalent in men, from my experience. Next slide, please, Lauren. Right, alcohol. So the WHO say there is no safe level of alcohol use. In the States, the dietary guidance over there is a bit less strict. They say moderate drinking, up to 2 standard drinks a day, will not adversely affect most people's health. So what is a standard drink? So 335 mils of 5% beer, 150 mils of 12% wine, or 45 mils of 40% spirits, i.e. vodka, whiskey, etc. So a couple of drinks of those a day puts you in the US dietary guidance for moderate drinking, which is regarded as being relatively safe. Now, unfortunately, excessive drinking is associated with increased risk of liver disease, heart disease, cancer, be it the liver, colon. It's also connected with oral and throat cancers. I didn't add that in. My apologies. Cognitive decline, alcoholism, unfortunately, mood disorder, and suicide. So there's a lot riding on this. It's something which certainly, obviously, I'm from the UK. In the UK, there is a bit of a drinking culture, at least there was when I lived there, and it's about recognizing what's going on. It's not good for us. Having a drink at the end of a busy day can help to unwind, but unfortunately that quite quickly can become maladaptive, unhelpful, and quite frankly bad for us. And the focus at the moment is thinking about, obviously, our mental health. It only makes things worse over time. Next slide, please, Laura. So maladaptive masculinity, I've mentioned it a few times already. What is it? So it can be seen as a decades-long pressure for men to conform to a perceived masculine archetype. For example, boys will be boys, boys don't cry, take it like a man. Now, these sentiments can lead to some negative behaviors, such as not displaying our emotions, bottling things up, pushing things down, aggressive behavior. Sometimes we reach the end of our limit where we can't reason, we can't explain ourselves any further. We as men can sometimes get aggressive. And not seeking help when needed, as highlighted, that will be highlighted throughout the talk. This is the one thing I can leave you all with. Please don't be afraid to come and see a doctor and talk about how you feel and how you are. It's a safe place to do so. It's why we're here. Okay. So again, to iterate on the last point I've just made, really, really important, because it means that men are less likely to seek the advice of a healthcare professional, be it a doctor, nurse, etc., 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 which can lead to a missed or late diagnosis. When I was training as a doctor in the UK, we used to, it was drummed into us, it isn't so much the patient in front of you that you should be concerned about, it's the patients you're not seeing. So we're always taught to ask about the family, ask about brothers, uncles, dads, granddads, are they coming in? Are they seeing their doctor as well? Because the levels of disease that we miss, that we don't even get a chance to do anything about, is unfortunately very, very high. And it's something which is still clearly very, very concerning, still a massive issue. Next slide, please, Laura. Right, so what is positive masculinity then? So not being afraid to ask for help from either one's peers, one's friends, family unit, or your doctor. Displaying vulnerability is not a weakness. Putting your hand up when you need help is actually a smart thing to do. It's not weak. And coming to see your doctor when you're not sure, when you're struggling, is a good thing. It's why we come to work in the mornings, and it's what we want to help people with. Being able to talk about and display emotions, again, within the workplace, the family unit perhaps, but definitely with your doctor. Let the doctor know how you feel, because the more we know, the more we can help. Most of the things I've been talking about and will talk about in the rest of the presentation, incredibly common. From my point of view, I see it week in, week out, and have done for the past however many years. And it's all treatable if it's caught early. And that there's ways to move through things, there's ways to improve quality of life. Other things that positive masculinity can do is build up healthy relationship skills, using active listening, open communication, and being supportive to one another. And then finally, being ready to stand up against aggressive behavior, the so-called maladaptive masculinity. We still need to be strong within our workplace, within our groups, within our communities, to see what is wrong and try and put it right. Laura, next slide, please. Right, moving on to cancer. So, prostate cancer. Now, UK data puts prostate cancer at the top of the list for men's cancers. Globally, it's the second most common cancer in men. Now, when it comes to risk factors, family history is probably the most important thing here. So if it's in the family, dads, uncles, granddads, etc., they've got it, there's a chance that you could be getting it, so you need to go and see a doctor. And over the age of 50, it becomes more common. Now, challenging things about prostate cancer. Usually there's no symptoms at an early stage. Some men can have problems peeing. So by that, what I mean is having to go to toilet more often, rushing to go to the loo, struggling to get started with a stream of urine, struggling to stop, like stop dead, like instead the men start to dribble, and having to go to toilet at night. Now, these are quite tricky because they're quite nebulous. They don't come all at once. People sometimes don't realize until they've been asked by them, specifically by a doctor. There's also other causes for them. So, for example, some of the urinary issues can be due to tea, caffeine in the diet. Some can be due to an enlarged prostate, which is a different thing from prostate cancer. An enlarged prostate is, I wouldn't say it's normal, but it's certainly very common as we move through our lives. Our prostates get bigger. Quick aside, what is a prostate? So it's a little kind of walnut-shaped gland that sits just below the bladder, around the tube, which the urine goes out of, essentially. It's a gland that produces hormones for the man, and over time it gets bigger. Prostate produces a chemical which we can pick up in what's called the PSA test. It's a blood test that's commonly used. It's not perfect. Unfortunately, even if we get a normal PSA, it doesn't exclude cancer in that man. And if we have a PSA that's slightly raised, then 3/4 of men aren't going to have prostate cancer. What it does is open up a further discussion point from my point of view. It means that I'll be able to give better quality advice to that individual sitting in front of me, counsel for the future, and more importantly, get a plan in place for following up. Prostate cancer is also quite difficult because there's different types of it. It's not just one type. So you've got rather aggressive types of prostate cancer, and unfortunately, that's what men die from. Then you've got the slow growing, very indolent, very benign cancers in the prostate that men die with. If we were able to get a cohort of men in their 80s and 90s and do an autopsy after their passing, we'd be able to look into their prostates and see a lot of those men, if not the vast majority, would have a form of slow growing prostate cancer. So it kind of shows what we're up against understanding this disease. A lot of work is going into it worldwide, trying to get better screening tests, better ways of picking this up. But ultimately, the thing that we can all do as men is go and see our doctors when we're not sure. Laura, next slide, please. Testicular cancer. So this is the most common cause of cancer in young men between the ages of 15 to 44. Half the cases of testicular cancer occur in men under the age of 35. So it's a relatively young man's disease. It presents with lumps in the testicles. So key here is to practice self-examination, getting to know what your testicles normally feel like. On the next slide, please, Laura. There's the testicular self-exam from the Testicular Cancer Awareness Foundation. Now, this is best done when you're relaxed after a warm bath or warm shower, one testicle at a time, cupping it in your hands, rolling it around your thumb, your forefinger, get a feel of what it actually feels like. What you'll discover, as many men do, at the back of the testicle, there's a cord that attaches, and there's a small lump there. That's completely normal. Most men I see about their testicles, it's usually that. However, even if you do feel that, still come and see a doctor, let us know that you felt it, and we can talk about what we're going to do next, moving forward. Essentially, the lumps that we want to know about are the lumps that you haven't felt before. So get to know what your testicles normally feel like. Okay. Next slide, please, Laura. Right, on to lung cancer and bowel cancer. Again, not male specific, but unfortunately, very, very common in men. So lung cancer, globally, the most common cancer in men. Again, don't smoke. If you do, please stop. The question that everyone asks me is, sorry, I just changed my, beg your pardon. Where am I? Here I am. Yeah. If you do, please stop. Vaping, we just don't know enough about it yet. It's not been around long enough for us to have long-term data on its safety. So we just don't know. What are the symptoms of lung cancer? Unexplained cough, coughing up blood, or weight loss. If you get any of those, please go and see your doctor. Unfortunately, with lung cancer, it can be difficult to pick up. Again, having a cough and losing a bit of weight, there's lots of reasons why that can happen. Same with coughing up blood, unfortunately, there's lots of reasons why. Now, most people go to see a doctor when they cough up blood, but not everyone comes in if they've got a bit of a cough for a few months, unfortunately. Not everyone comes in and notices a bit of weight loss for a few months. So if you are having those symptoms, you've not got a reason why, please see your doctor. Bowel cancer, globally, it's the third most common cancer in men. There is bowel cancer screening widely available, a stool test looking for tiny amounts of blood, which is very useful. With bowel cancer, More so than lung cancer, family history really plays a part here. So if it's in the family, you need to let your doctor know, and then we can take things from there with regards to screening, further tests, and possibly some more investigations in the hospital. When it comes to diet, we do know that low fiber diets in highly processed foods or fast foods or ready meals, unfortunately, have an increased risk, carry an increased risk of developing bowel cancer in the people who do very often. So again, fiber is our friend here, seems to improve our risk profile when it comes to bowel cancer. So as a person, if you have an unexplained change in your bowel habit, if you get blood in your stool or you're losing weight, please come and see your doctor. Again, I accept that changing your bowel habit, sometimes that can just happen for a few days. We don't know why. It may be an upset stomach, maybe what we've eaten. Weight loss, ditto, it can fluctuate somewhat. Usually what I tell people, if it's there after a couple of weeks, please come in and see me. Blood in the stool, generally speaking, brings most people into the doctor, so that's a good opportunity for me to go through things with them. Next slide, please, Laura. Right, we're going to round things out with a brief word about hormones, testosterone, and the male menopause. So the first thing to say, this doesn't really have much to do with the female menopause. It's different. How is it different? Well, it starts earlier to begin with. So there's a gradual decline in testosterone levels after the age of 30, but not all men notice symptoms. And there's loads of evidence out of the UK, where I'm from, that actually 3/4 of men maintain a healthy testosterone level throughout their lives. So it's by no means a done thing that your testosterone levels will drop dramatically after the age of 30. You can still maintain a healthy level and be asymptomatic, because most men, not all men, sorry, what I should say, not all men actually notice symptoms. Anyway, so what are the symptoms? Loss of libido, fatigue, mood changes, decreased muscle mass and strength, weight gain, erectile dysfunction, sleep disturbances, and reduced cognitive function. Now, that's quite a broad list of different symptoms. There's lots of reasons why people can have those symptoms. However, if those symptoms are present in you for, say, more than a month, please come in and see a doctor, and we can have a conversation about your symptoms, their time frame. We can examine you and organise blood tests. Quick word about the blood tests. Testosterone, like many things in the body, it fluctuates quite a lot. And it fluctuates during the day. It fluctuates depending on what you've been doing, how much stress you've been under, exercise levels, if you're overweight. It can change quite a lot. So normally with testosterone levels, I usually like to repeat it at least 6 weeks apart. And I like to get a handle on what's going on in the man's life. Now, primarily, treatments through lifestyle, we correct what we can correct. So we think about sleep quality, reducing alcohol, reducing stress, think about diet, and we think about weight loss. And then we see where that takes us. The big thing, which has been a really, really hot button topic for the past 5-10 years, is testosterone replacement therapy. Now, this works well for some people. And for some men, it's life-changing. There's no doubt about that. And I'm certainly not against it. As with anything good that I can say about a treatment, there are risks. There's always strings attached. So it has risks of increased risk of cardiovascular disease and prostate cancer. Now, this is an evolving field. I would say testosterone has been certainly championed by a lot of people in the fitness community online, a lot of people with maybe an influencer in their title on Instagram, for example. And it's been seen as an end-all and be-all for lots and lots of men. Now, problem with using testosterone for kind of bulking up or getting bigger, unfortunately, fertility becomes an issue. It can be affected in younger men, as in older men too, but younger men specifically. So it isn't risk-free. If I could say one thing about it, I'd kind of leave it there. I know that people use it. I meet a lot of patients that use it. We have these conversations. I present the risks. I let them decide because it's their life ultimately. But all I can do is kind of present to you the health side of things and let you as the individual make your own mind up. Now, testosterone, it's an evolving field, like a few of the things we've been talking about. As we learn more about it, we can give better advice and counsel people more effectively on the pros and cons of testosterone replacement and whether or not actually using it in the first instance the right thing for you. There are, again, allied sort of health services promoting other means of boosting testosterone, different types of supplementation. Again, an evolving field. I'm sure there's merit to it. I'm not against it, but at the same time, I want to see a little bit more evidence before we, as doctors, commit wholeheartedly to it. So again, an evolving field, an evolving field. I look forward to learning more about it as things pan out in the future. Next slide, please. So in summary, we're nearly finished, I promise. Improving men's health. So the starting point is being aware of what's common, and hopefully after this talk, you've got a rough idea of what to be looking for. Know the risks and the warning signs. Go and see your doctor. If you're not sure, please ask. That's why we're here. Monitor your health and exercise, and drink alcohol in moderation. Do not neglect your mental health. Common issue, and it's a treatable problem. From my point of view, most people I meet with mental health issues, we can treat very effectively, reasonably quickly actually. Remember prostate cancer screening if you're over the age of 45 and earlier if you've got a family history. Testicular cancer is a cancer of young men, so please check yourself regularly, and it's totally curable if it's caught early. Bowel and lung cancer, again, very treatable if caught early. If you're not sure or you're concerned, come in and see your doctor. And then finally, testosterone, as we've said, many men maintain a healthy level. And a lot of what we can do as individuals is have a healthy lifestyle, the things that we've been talking about, and the chances are we will maintain a healthy testosterone level. Final slide, please. Thank you very much. Do you have any questions? And then I'll leave you with the probably the most important thing I've got to say, which is please get a regular family medicine doctor and go to see them. Thank you.
Wonderful. Thank you very much for that information. It was, yeah, even I learned a few things there, which is always helpful. Does anybody have any questions that they would like to ask Dr. Berks today? You can just unmute yourself, ask away. Or you can even put it in the chat. So I do have a question here. It says that I often struggle with broken sleep and feel tired even after resting. What is the best natural way to improve sleep so it's restful without using any powerful medication?
Sure, absolutely. Yeah, really, really common issue. I think a bit of a 360 approach to this. If you're going through a stressful phase in life, work, kids, family, etc., we have to accept that sleep is going to be a bit bumpy, so we have to manage expectations. Beyond that, a good sleep hygiene regimen. So for many people, caffeine can be a big problem. So reducing our coffee intake after lunchtime, as an example. I'm going to have to give quite general advice here, but it still sticks. Exercise in the morning for many people seems to really help set the hormone level for the rest of the day, so the normal hormone level can be regulated. So in the evening, we're feeling more tired. That's not an absolute catch-all for everybody, but it seems to help. Not eating too late at night, so giving ourselves time to digest our food so we go to bed not completely stuffed full. Having a wind down period before we go to bed, maybe an hour before, so we're turning the lights down, we're putting something a bit more relaxing on TV, we're turning the music down, we're getting away from our phones, spending time with our loved ones. If we've got a significant other, a bit of intimate time with them never seems to hurt. Restful sleep. In terms of other things we can do, it's sort of non-pharmacological, the chamomile teas, the herbal teas, that all works. It works really well for some people, not for everyone, but it works well for some people. It's worth trying if you've done already. There are sort of natural sleep aids that people use, some herbal remedies. Again, they work well. It's not my area of expertise, but again, if you're familiar with it, it's worth a go. Clearly, there are, for some people, medications available, which I'm not going to go too far into, but it's the kind of thing that if things got to that stage, I'd hope you go and see a doctor. The final thing on the medication note, which I'm kind of like slightly hammered on a little bit, but zinc magnesium tablets before bed seem to really, really help. Completely natural, completely harmless, completely sustainable. You can use them year in, year out. They seem to be as good as anything else that we recommend. So, and that's available in most pharmacies. So yeah, sleep hygiene, what I call caffeine discipline, and getting a good routine before the bedtime to try and get a better quality of sleep.
Perfect. Thank you very much. There was another question that came in as well that just said, how often should I have my vitamin levels checked?
Great question. At least once a year. But if you're known to have low levels, You need to do it more often, and your doctor should be able to guide you when you speak to your doctor. If you've got a history of low levels that we need to keep an eye on, it's going to have to be more regular. People often ask me about supplements and vitamins, and yeah, I've got nothing major against them. The most important thing to supplement is what you're low in. Otherwise, your diet, if it's halfway decent, should take care of most things. Vitamin D in this part of the world is a bit of a hot topic because if you're anything like me, you spend your life indoors. So that realistically, I think most people should be checking that at least once a year, if not twice, to know where they are.
Perfect, thank you. Another question here as well. It says, I was just wondering why there seems to be such limited data and statistics around the effects of vaping on lung cancer.
Sorry?
Did you understand that one?
Aging and lung cancer, did you say?
Vaping.
Vaping, yeah.
Yeah, why is there such
limited
thing is,
statistics? You ask yourself, who's going to fund it? Not to call it what it is. Who's funding the research? The vaping companies aren't going to be particularly pro-funding it, and the same with the cigarette companies weren't. Sounds a bit cynical, but unfortunately that's how medical research can sometimes work. I don't think there's a massive political push for it at the minute. I think collectively so many people are so happy smoking's down that we're kind of waiting and seeing, but I haven't got a very good answer apart from the slightly cynical one I just gave you.
Yep, no, that makes sense as well. And one more has just come in. It's just said, at this stage, I've really seen a decline in my mental health. What would be your advice and my first steps to...
See a doctor, please. Go and see a doctor. And that stands for anyone who's in the audience who has any kind of query, please go and see a doctor.
That's wonderful advice. Wonderful. Well, I just want to thank you again, Dr. Berks, for your very informative session. I'm sure that you have helped educate quite a few today. And just remember, if you do have any further questions or you are looking for a doctor to see, Dr. Berks is you're at what location, if you could just remind me?
Dubai Hills Mall, Mediclinic, Dubai Hills Mall. We're on the first floor. We're a little bit tucked away in the corner near the indoor roller coaster. So if you look for that, you won't be far from us. But Mediclinic, Dubai Hills Mall.
Okay, that is wonderful. Thank you so much for today. And yeah, I wish you all the best. And yeah, thank you again.
Thanks indeed. Thank you, everyone.
Thank you.
Bye.
Bye. She was missing.